Hello and welcome to Voices from the Field. This is an interview series by the World Health Professions Alliance as part of the Positive Practice Environments campaign this year. And I'm very happy to have with me Josep Guiu, who is a hospital pharmacist from Spain. This is the very first interview of the series, and I'm so delighted to have Josep with us. Josep, could you please introduce yourself?
Hello, Helen. I'm Josep Guiu. I'm Director of Pharmacy and Medicines at the Consortium of Health and Social Care of Catalonia in Barcelona, Spain, and work in an institution that represents a group of public and non-profit hospitals in Catalonia, the northeast of Spain.
A beautiful part of Spain as well.
Oh, thank you.
One of my favorite cities, Barcelona. So tell me, Josep, did you always want to be a pharmacist, or what brought you to the profession?
Well, no. When I was at the high school, I explored the different possibilities about my future, and pharmacy was a career, a profession with that combined the chemistry, combines aspects of the medicines, the physiology seemed like very interesting, and I went for that. And then after that, the things went alone, and I decided to be a hospital pharmacist. And well, I enjoy with my profession. Maybe I would not shoot the same again, but I think it's a good. It was a good decision at this moment, and we can, as a healthcare professional and the hospital pharmacy, we can do a good work for our patients, and I'm happy and proud of that.
So when you say you're a hospital pharmacist, can you describe what sort of environment you work in?
We, as hospital pharmacists, we work in a hospital. Our work is to be part of the healthcare workforce in the hospital, to provide and to care about the medicines in the different workflows in the hospital, to ensure the best use of the medicines, and also to ensure that the medicines are available for the treatments in the most effective, efficient, and safety way for the patients.
So I imagine that you work very closely with other health professionals within the hospital. I imagine it's really a team. Can you explain a little bit more about that?
Yeah, well, in the hospital, as hospital pharmacists, we work closely with the physicians, with the prescribers, and also with the nurses who administer the medications. So we work closely with them to ensure that the best use of the medicines, and to provide the most safety use of the medicines, and to avoid medical errors, and to avoid adverse events, and to ensure that patients get the most benefit of the treatments.
Okay, and so I imagine in the last 18 months in the COVID-19 pandemic, it's been very challenging for the hospital in general, for pharmacists and other health professionals. Can you sort of give us an idea of a day in the life, in the, especially in the heart of the pandemic, when there were so many people, possibly people being turned away, not being able to be treated, etc. How did you live through that? What was your biggest challenge through that really very, very difficult period?
Yeah, at that moment, we had to keep apart several things that we do in our daily practice, and to adapt at that situation. One of the main challenge or worries we had was the shortages of medicines. To ensure that we get the medicines, to speak with the providers, we speak with the administration, to try to make predictions about our stocks and to avoid stock outs, of the medicines, also to work closely with the teams of the hospital to build field hospitals. At the moment was the need to provide medicines also for field hospitals, and also for ambulatory patients, trying to avoid them to come to the hospital to get their medications, to build other workflows with volunteers, with community pharmacies, to provide them their medicines through the community pharmacies, through the volunteers, through the packaging vendors, to avoid them to come to the hospital to get their medications, to implement telepharmacy, just to try to phone the patients, to keep them calm, to give the same advice that we do face to face, but on the distance of the phone, or sometimes in a similar way that today in this Zoom or other video conference platforms.
So I imagine with all these new challenges and need to adapt very quickly, that was difficult. No, I mean, how did you navigate that? How did you keep a good head? How did you find solutions and adapt things? And the environment in which you work, the hospital, was that supportive of what you were doing? I'm just trying to imagine. You make it sound almost too easy. I imagine it was a very challenging time. How did you navigate that, and what sort of support was there for you and the others?
Well, in hospitals we suffer several crises, not as big as that it was the COVID-19 outbreak or the first wave. But the problem was the uncertainty about how the team would be affected, and to ensure also the workforce or the health workforce was available. So we try to distribute the workforce, that people keep at their homes just to be available if some of the other pharmacists or pharmacy technicians got sick. It was a quite difficult decisions, because so we had less people working in the hospital, but ensuring that we had the possibilities to provide the healthcare assistance, even if some of the people or the workers got sick. So it was quite stressful, and our work was to prioritize which were the actions to be taken.
And personally, how did you manage that stress? It must have been awfully, well, stressful, but also scary, seeing the wave coming and knowing that you in particular and your colleagues were at risk of catching the virus. How did you personally manage that stress?
Well, speaking with our colleagues, because at last we found that we all had the same problems. Probably one of the main problems of healthcare professionals was our own personal, how to manage that situation with our personal lives. For example, in my case, my partner, my wife, is also a healthcare professional. She had also to be in the hospital, and we had the children at home. So we had to combine that situation between the two of us, because when we were at home, we also had to work at least remotely with the video conferences, with the team building, with the video conferences, but with it taking care of our children. That was a bit, I think that was the most stressful part of the situation, to combine our personal life with our responsibilities as healthcare professionals, and also with the uncertainty or the fear to not contaminate or not to got our children sick by our fault, because part of our time we were at the hospital. So I think that was the most stressful part. It was not an individual situation, because many of the healthcare professionals were in the same position, were in the same situation, with different solutions, but at last, sometimes not seeing our children or our family for several weeks, just to try to protect them for the virus, and that was the most difficult part of the story. But we had a good team, and we shared the situation, our emotions, with all the rest of healthcare professionals, not only in the pharmacy, with also the nurses and the physicians at the wards. They were in the same situation, and between all, we make that effort, and I think it was worth to do that, to provide this care for the patients and to overcome that situation.
I think that's a really important point, because, you know, you were called heroes and people clapped for you in the evening, etc., and very much appreciated, outwardly appreciated health professionals and other care workers during the pandemic. But I think it's too easy for us to forget that there are people behind the PPE. And I think it's really interesting to add the level of stress that you've got children at home, or maybe elderly family, and that you can't see them for weeks, and you're worried about them as well. And I think that coping mechanism it's not the first time I've heard also of how important it is to share how you're feeling, and be in a supportive environment. So when you talk about sharing your feelings with other colleagues and feeling like part of a team, and you are able to talk about common issues, that was really key to getting through this very, very difficult time. It's really interesting to hear. So what did you particularly appreciate about your personal workplace through this time, this very challenging time?
Well, I think in our organization, it was concerned about the situation and trying to conciliate as much as possible our personal lives, and try to avoid that to be in person at the hospital. It was not absolutely necessary. I think that was the most respectful thing and the most smart thing about our organization. The other was to create a different team building. When we were at home, sometimes we felt like I'm not helping enough. How are my colleagues? And through the video conferences, we get daily meetings, and just that help us just to be connected with the situation, feeling that we were trying to help, at least remotely, when we were not at the hospitals. And I think that helped us to consolidate the team, and also to feel that they were also useful, and also not feeling alone when we were not at the workplace.
Yeah, so you didn't feel like you were leaving them alone and you were having a break, and that to know that they were okay as well, and that you were part of a team. And just because you were having a break, which you absolutely needed, didn't mean that you weren't part of the solution. And that, because that could feel very, very frustrating. You know, I think, well, I hope we've learned a lot during this pandemic. If, God forbid, we had to do this again, is there anything that you would do differently next time? What have you learned? What could you suggest be done, either you personally, you as a team, you as a hospital? How could it have been managed maybe better? Can you think of anything?
Well, the problem of this pandemic, it has been the several waves, because maybe the first wave, it was quite difficult to predict, and the intensity of the wave. The problem of the pandemic was the second and the third wave, because people felt so tired, and that it was not planned enough for the managers and the governments to do the best, or all they could do to avoid these new waves. And I think that to take care more about the people trying to get the rest, to feel not that they are tired, they're exhausted, to face the new waves, or to face the different kind of environment, because during several months it was like a different work, just taking care also always the same kind of patients, and facing it was monotonous problem. It was the COVID, and the shortages was in case of the pharmacy, it was not a punctual problem. It was like spreading during weeks and months, and I think the people felt tired about that we had to do more strong or efforts to trying to solve or to avoid the new waves, to be and to be prepared and not to be so exhausted.
Yeah, and I guess it was very difficult because nobody knew, right? So it's difficult to plan, and it's often easier to manage if you can see the end, you know, the light at the end of the tunnel, but it was just going on. And as you say, you thought you'd got through the worst of it, and then another wave would come, and you hadn't really recovered, I imagine, from the first wave. So I guess you found ways of managing things better, but in the end, I guess right now, you know, we hope to see the end of this pandemic soon. You know, vaccination rollout is coming to various levels of success around the world. But what is your biggest challenge now? Because we're not finished. The world is not back to the original normal. What are you facing now as a health professional, as a hospital pharmacist? What's your biggest challenge now?
Well, our main challenge now is try to we are seeing that we need to recover part of the healthcare activity that has been kept apart. Some patients, they were forgotten during all these months, and then they are arriving at hospitals with disease that maybe are more complicated, that could have been if they have been treated before. And trying to provide the care for these patients, not to the queuing list to be the most short as possible. And well, we are facing like kind of crisis, so overcome to the best use of the medicines, because of in the hospitals we had spent a lot of money during this pandemic, and we have to overcome with a new also economic situation that it's quite unpredictable, because all these months have altered everything about our predictions or our expectations about the future. So just trying to adapt to this strange behavior of the pandemic, that it's not resolved yet, and try to say that if we can get to the normality, but to ensure that all the patients that we kept apart are not going to be treated and taking care of them.
Okay, and if I was to give you a magic wand to magically make things, or have a wish, what would that wish be? What's your number one wish for the world, or for the world that you live in, to improve the situation?
Well, not in the hospital, but in the primary care, they had also a big challenge. I think in the hospital, we have been in the, not the similar work, but in the hospital environment work. Our environment has changed to adapt to the COVID, but in primary care, as they are the first fence and the first attention of the patients, and some of the patients, they went directly to hospitals. So we have to rebuild our primary care and to work closely, hospitals with primary care pharmacists, with primary care physicians, to integrate the healthcare, to be more prepared for next pandemics, but also for the pandemic that its chronicity is the aging of the population. And we cannot also only think about the new pandemic. We have to think about our current patients and to take care of them and to provide the healthcare assistance to them.
Yeah, you're absolutely right. We can't just focus on one pandemic. There's a lot of things that have been, as you said, left to the side because it didn't seem so urgent at the time. And then that's creating a long-term effect and stress on the health systems as well. And if you were to have one message to fellow health professionals out there who maybe need to hear something inspirational or encouraging, do you have a special message for the health professionals?
Well, for me, healthcare professionals, we are a team. We work as a team. And I think the most important things and the most valuable things of our profession is to work as a team, because as a team, we are better, we are stronger, and also we are, I think, the best way to provide the most excellent care for patients. And just to take care of our team and to integrate also the multidisciplinarity in our teams, different points of view, the different knowledges in this team.
It certainly sounds like a smart way of the way forward. And I think maybe one positive that's come out of the pandemic is the need to work together, because I know that healthcare systems can seem quite siloed and separated, but when it comes to it, everyone needs to pull together, and that is the best, not only for the patients, but also for the people behind the PPE, so the health professionals who are providing the care. Okay, great. And do you have any final message maybe for the public at large, people who don't necessarily work in the healthcare systems? You know, at this stage, we're talking in October 2021, seeing hopefully the end of the pandemic, the vaccine rollout, etc. What is your message for the public in general?
I would like to thank the public for trusting with the healthcare professionals. I think this pandemic has shown we have a great gratitude for the public, because they have trust with us, they have trust with the evidence, the dynamic evidence that has changed over time, and it's difficult to assume that. But also, I think I will encourage them to take care of their own health, because they are also responsible for their health, to be aware of the preventive measures to avoid to get sick. We will be there if they get, but I will encourage them also to be healthy and to have a healthy life, to be as healthy as possible.
Brilliant. Well, thank you so much, Josep. I really enjoyed talking to you today, and good luck over the next months as it gets colder, as the vaccine rollout continues. And I look forward to catching up with you maybe in a few months' time to see how things are.
Hopefully.
Thanks so much.